So a lot of patients ask, how do I make my eyes look bigger? But you gotta be careful. It has to be balanced and proportional to the rest of your face. So whenever we talk to patients about strategy to make the eyes look more bigger, a lot of times what we focus on is how do we accentuate the eyes and keep the balance and proportion and don't change a whole lot of who you are. But basically when we talk about the eyes and making it like bigger, we got to talk about which direction do we want to make it bigger. So there is what we call vertical aperture, which means how much do they open up vertically, and the horizontal, how long are they? And so in terms of horizontal lengthening, because a lot of patients, they do want their eyes to look a little bit longer. There are two directions in which we can actually increase that size. We can open up the inner corner, or we can open up the outer corner. And everybody's really different. But a lot of times we do a medial epicanthoplasty, which means opening up the inner corner. For a lot of Asians, they do have what we call an epicanthal fold, which means there is kind of an extra skin that tends to hood over the inner corner of the eyes. So what it sometimes does is that it kind of cuts off the inner corner of the eyes so that the eyes look shorter. And so medial epicanthoplasty, which is an incision in the inner corner of the eyes to open that up, really does help in patients who are really candidates for it. Not everyone's a candidate for it. For example, if their eyes are already long to begin with, or if their intercanthal distance, which means the distance between the two eyes, are close already, you don't really want to open up the inner corner because then everything will look too close together. So that's medial epicanthoplasty, which means opening up the inner corner. The outer corner is what we call lateral canthoplasty. And for some patients, the outer corner of the eyes gets cut off, or it's kind of short. And the limit as to how much we can open up the outer corner really is dependent on how close that bone is. Because the limit of how much we can open up is right at that bony starting point. And so for some patients, they really are a good candidate for that lateral epicanthoplasty. The vertical aperture, a lot of times for Asians, they do have a congenital ptosis, which means that the eyes don't really open up all the way. And that's really because just innately, there's a muscle that we use to open and close our eyes, and that's kind of innately weak. And so what we do surgically a lot of times, especially when we create a double eyelid, is that we tighten that muscle, what we call the levator aponeurosis. We tighten that muscle so that even if the muscle's weak, because it's been tightened, that more of the eyes open up. So that increases that vertical opening. So this is all like completely what we call 360-degree direction in which we can kind of open up the eyes. But as I said, it's really important to make sure that we don't overdo these type of procedures because it really has to be balanced with the rest of your face. If you enjoyed this video, please click like and subscribe to our channel.